closure support fails here, but the healing is here, you're going to have the wound bust open, which is called wound dehiscence. So in a nutshell, we solve the problem of wound dehiscence and of wounds breaking open after surgery. And so we have clinical studies where we've shown that we reduce dehiscence on lower extremity excisional wounds, so the kind of wounds I make, we reduce dehiscence by 89%. In amputations, we reduce dehiscence by 80%. We actually reduce the need for reamputation in lower extremity amputation. And it's just because of those fundamental things. Better perfusion, less crap. You know, I did a study a few years ago on suture spacing, because another dogma is that the higher the number of sutures per inch, the better. Like, oh, they almost look like sewing jeans, right? Well, skin is not jeans. Skin has to heal. Denim is not going to heal. Like, denim is not going to heal together so that you can remove the stitches. But with humans, the stitches are going to get removed. So the less we can do to the skin, the better. So I did this study a few years ago where we just put one deep in the middle and one top in the middle, and then we bisected the wound. One half of the wound got high, like normal high density sutures, so stitches every like 3 or 4 millimeters. The other side, I did stitches every 9 millimeters. Which side healed better? The one that you didn't strangulate. It's Goldilocks. You want to put in enough support. It's not like sewing jeans. With sewing jeans, you can't have too many sutures. I'm sure there's people who sew jeans and it's like, yes, you can put too many sutures. But, you know, like double rows and triple rows of seams is not going to make the jean less strong. Putting too many stitches into a wound that's healing is going to strangulate the wound. And so there's a Goldilocks. Yeah, I'm not saying just if you've got a wound this long, you put 1 stitch in it. But putting 1,000 in it is probably worse than putting 1 in it, because the wound edge gets no blood supply. And so that dogma of higher number of stitches is just not true. And so anyway, we published that. So fewer complications, and the wounds looked better with few stitches.